Hi, my name is Valine Whitaker, and I am a psychologist in outpatient mental health and the hospital's military sexual trauma services coordinator. I came to Bedford in 2013 as a psychology postdoctoral resident in the newly created Interprofessional Education and Program Development Fellowship.
Hi, I'm Adam Chamberlain. I'm a second year family medicine resident.
Hello, my name is Stacey Tionis, and I'm a nurse educator at the VA Bedford Healthcare System. My VA journey began my junior year of nursing school when I was accepted into the VA Learning Opportunities Residency or VALOR program at the VA Bedford.
Hi, my name is Emily Forbes, and I'm a clinical social worker at the Bedford VA in the Veterans Integration to Academic Leadership program.
Hi, folks. My name is Brian Stevenson. I'm a psychologist here at the Bedford VA. And I actually completed my pre-doctoral internship training year here about 3 years ago.
I enjoyed my time at the VA for mostly a couple of reasons. The first one being the patient population themselves.
That year, I worked with a woman of color veteran who was struggling with a range of complex mental health and medical challenges. And as her therapist and primary contact in the clinic, I took initiative to convene a consultation meeting with interprofessional providers from across the hospital.
It informed the trajectory of my career. Some of the experiences I had, which I hadn't had really the time and the ability to do in a thorough way before, was have serious illness conversations and end of life conversations that have been some of the most meaningful parts of my residency training so far.
These rotations improved my knowledge, clinical skills and judgment, critical thinking, and prepared me to enter the nursing profession. It was from this experience that I found my passion for psychiatric mental health nursing.
And one standout moment of my training year was actually getting to go outside of the VA and go into the community with a senior psychologist.
Very nice to be in an environment where you have time. You have time to sit down with your patient and talk to them and really go through the history, interact with them without time constraint. The fast pace, admissions and discharges, and all those things you need to do in training, in residency, in fellowships, for instance. And it was a very welcome break for sure.
As a trainee, I don't think I would have felt empowered to independently convene a meeting with full-time staff if I hadn't been trained and educated in a hospital and a mental health service line where this kind of collaboration on behalf of veteran-centered care is encouraged.
My experience specifically on the GEM unit at the VA was an extremely important one for me.
I thank the VALOR program, the VA Bedford staff, and the veterans for empowering me to become the nurse I am today.
I think that my training background really helps me to understand the different strengths that each of us are bringing to the team, but also knowing where a team member's perspective can really add exponential benefit to an idea or to a plan.
And so witnessing this direct connection between this creative, recovery-oriented intervention and the veterans' own success has really lasted with me today as a staff psychologist.